Drinking caffeine in pregnancy is an interesting question because there's multiple studies on caffeine in pregnancy, but they're not well controlled for the actual amount of caffeine, the type of coffee, like in terms of Starbucks versus Dunkin' Donuts, because they do contain very different amounts of caffeine. Generally speaking, there's been a suggestion in some studies, but not all, that there may be a slightly increased risk of miscarriage in the first trimester. Now, that being said, I do not make people crazy. People come in and sometimes they'll say, oh my God, I didn't realize I was pregnant. I've been drinking coffee. There's no association with malformations. It's not a teratogen, teratogen meaning it causes a malformation. It's a suggestion of an increased risk of miscarriage, and it was, again, not in every study. So, again, for a purist, a lot of women, especially with first pregnancies, they're very anxious. Again, we'll tell them maybe don't drink it in the first trimester. Later on, small amounts. Again, I am a person who believes in things in moderation. I think 1 to 2 caffeine containing products over the course of the day is okay. Whether it's coffee, tea, a diet soda, again, diet sodas, then you get into the whole issue with NutraSweet and Splenda, and is that kind of stuff okay? And again, in moderation, probably fine. Some of our patients are gestational diabetics. They can't have sugar. They want something sweet. So again, all of those things probably okay in very small amounts. I don't think you should have tons of caffeine. I wouldn't have more than 1 or 2 products per day. There may be an association with low birth weight in very, very high amounts of caffeine, but again, studies are sort of mixed. They're all over the place, and they weren't well controlled for the quantities of caffeine. Sometimes people will ask me, can I have decaffeinated products? That's an interesting question too. It depends on whether it's chemically or water decaffeinated. Some people feel if it's a chemically decaffeinated product, the chemical may actually be worse than the caffeine itself. So, I would lean more towards having a tiny bit of caffeine rather than having a chemically decaffeinated product. So again, small amounts probably fine, and preferably after first trimester.